Hello everybody and welcome to the Thursday edition of Video Clips. I didn't talk to you on Tuesday because we sent the newsletter out on Tuesday because Monday was a holiday, and I hope you all ate well over the weekend. As usual, I'll start with a couple of announcements, really important, cool stuff going on. First of all, tonight is the Green Tea and Cancer workshop. I've said many times I don't believe in superfoods, but green tea comes close to being a superfood, and I'm going to talk about some of the very important constituents of green tea. It is the second most consumed beverage on the planet, so I think it's appropriate to spend a little time on it and know a little bit more about it. Second thing, on Friday and Saturday this week is the Informed Boot Camp, and this is I did a GI boot camp a few weeks ago. Everybody loved it, so this one is same concept, Friday night, Saturday afternoon, and we're going to cover things like how to read your blood test results. When should you be concerned about an abnormality? When should you not? Understanding how to read research. I'm going to turn you into independent researchers if you don't know how to look at a study and figure out if it's good or bad, so that I always tell people I don't want you to be a cynic, but I want you to be kind of a healthy skeptic when you look at some of this stuff. So those are the types of things that we're going to cover. I promise I'll make it fun, even though it's a little bit technical. And you will then be able to read studies like I read studies and see what I see when I see some of these things. And then the Wellness Farm Institute, school started this week with the Diet and Lifestyle program. We do record those classes, so if you wish you had enrolled but you missed the class that started last night, you can still do it, listen to the recording, and join us live for the rest of the series. Last but not least, it is only 2 months until conference time, a little bit less actually, November 4th through 6th. It's our 20th anniversary, and we think that's so cool. You know, I was reading an article in Inc. magazine this morning, and it's the Inc. 500 issue, and they interviewed a lot of the top companies, and they asked what was the most important thing that the entrepreneurs that were featured had to say about starting a business and achieving, staying in business and all that. They said surviving. Surviving is the most important thing, and I kind of feel that way. We did some surviving, but now we're thriving, and we do have a lot to celebrate this year. And our speaker lineup is amazing. I won't read it to you. Just go to wellnessforumhealth.com. It's all on the front page there, and you do not want to be hearing about this the week after and wish you had joined us. All right, let's get into the topic for today. More information is always better as a mantra of the medical profession, but in many cases, more information is not only not better, it can make things considerably worse. And that's what we're going to talk about today. The CA-125 test measures the amount of cancer antigen 125 in the bloodstream. Now, CA-125 is a protein on the surface of many ovarian cancer cells, but it's also found on other types of cancer cells and in tiny amounts on normal cells too. The test is commonly used to monitor some cancers during and after treatment, and it's increasingly being used as an early detection test for ovarian cancer. The problem is that it's not very accurate. Many things can cause increases in CA-125 levels that have nothing to do with cancer, such as a menstrual period or uterine fibroids. In one study of 799 patients, only 20% of abnormal CA-125 tests were due to ovarian cancer. False positives were due to things like other malignancies, benign ovarian disease, and other benign gynecological conditions. The researchers concluded in this study, these results confirm the high false positive rate and poor sensitivity and specificity associated with CA-125. The substantial inappropriate usage of CA-125 has led to results that are useless to the clinician, have cost implications, and add to patient anxiety and clinical uncertainty. In other words, the CA-125 test is plagued with the same thing that mammography and PSA testing are plagued with. They just don't do a very good job of telling us who does and who does not have cancer. A 2009 randomized clinical trial, including 1,442 patients, looked at whether patients benefited from early treatment based on higher levels of CA-125 as compared to patients who received treatment only when clinical symptoms presented. The researchers concluded that early treatment based on elevated CA-125 levels did not result in increased survival, but it did result in a worse quality of life. And the reason was that the test led to earlier initiation of chemotherapy, and the treatment didn't do anything to extend the length of the person's life, but it basically worsened their quality of life. And that happens a lot in cancer treatment, not just for ovarian cancer. The researchers concluded that there was no value in the routine testing of CA-125 for ovarian cancer patients. Another more recent study looked at 1,241 women in remission after treatment for ovarian cancer at 6 National Cancer Institute designated cancer centers between 2004 and 2011. Almost all the patients were being tested routinely for CA-125 every 3 to 4 months before the 2009 study was published that I just talked about. And this testing continued after the 2009 study was published. So in other words, evidence that the test was useless did not change the practices at the 6 National Cancer Institute centers. They continued to test women anyway. Dr. James Goodwin cites these studies in a recent editorial about CA-125 testing, which he says is an example of the, quote, fatal attraction of more information in medicine. Dr. Goodwin says that doctors can and do change when they're confronted with new information, but in the case of CA-125, failure to do so may be due to, quote, the fundamental attractiveness of testing. He says doctors like testing because they think more information reduces uncertainty and that more information cannot possibly harm anyone. He also says that doctors feel that they're very confident about their ability to take information and use it wisely. But Goodwin says, the new study shows that there's a big disconnect between what doctors think and what's true. In spite of evidence that the test is useless, doctors continue to administer CA-125 tests and continue to offer chemotherapy, which doesn't extend life but worsens quality of life. So they're not changing. They may think that they change in response to evidence, but they don't. Goodwin also points out that the authors of the recent study didn't frame the results well. So instead of reporting that there was no difference between testing every 3 months and not testing at all, they reported the results as being the same for early versus delayed chemotherapy. And so there was an obvious bias, I think, in the study. And when I give you a couple more quotes from the researchers before I finish here, I think you'll see that this is true in favor of testing. So the results were framed from the standpoint of trying to convey the benefits of testing to consumers. Goodwin seems to think that if the researchers had been, there'd been more straight talk about the issue, it would have resulted in changes of practice. Now, I have to disagree, and evidence supports my stance. For example, doctors continue to perform orthopedic procedures that have been proven to be useless. You've heard me talk about it in these videos before. And they recommend mammograms in spite of the fact that there is no evidence that they reduce the risk of dying of breast cancer. Doctors, their associations, medical institutions simply don't follow the evidence in making recommendations to patients, and it's the whole reason why our company exists, because patients basically have to get information and take control and know about this stuff and how to read it. That's why this Informed Boot Camp that I'm doing this weekend is so important, so that they can make intelligent decisions on their own behalf. They cannot just believe what they're told. The authors of the most recent study think that part of the problem is that surveillance testing is recommended by the 2015 National Comprehensive Cancer Center Network's clinical guidelines. They also make a statement that is hard to fathom based on the evidence, and I'm just going to read to you what they said. My jaw dropped when I heard this. CA-125 testing, quote, may offer a relatively inexpensive patient-centered approach to maximize treatment options by identifying recurrent disease before irreversible complications ensue that might limit opportunities for eligibility in clinical trials or secondary cytoreductive surgery. End of quote. Now, how can a test that has been proven to be useless and harmful be promoted as patient-centered approach to health? I mean, in what universe do these people live? The beliefs held by doctors and by virtue of their doctors' advice by many patients about CA-125 testing they're just completely disconnected from the reality of its usefulness in practice. As if this is not enough insanity, the authors actually argue that one of the benefits of the test is how affordable it is at only $28 per test based on what Medicare pays for it. Now, our friend Goodwin, who wrote the editorial, argues in his editorial that it doesn't matter how cheap the test is. For a useless test, quote, the issue of cost effectiveness becomes absurd. How can a test or treatment be cost effective if it's not effective, and indeed if it's harmful? He wrote in his editorial. I mean, I don't know this guy James Goodwin, but I kind of like what he has to say here. Goodwin shares my pessimism, saying that the practice of CA-125 testing will most likely continue since, quote, the fatal attraction of more information is too compelling. Lead researcher Catherine Esselin held her ground, however, stating in a press release that, and this is another one, just makes your jaw drop, it's very easy to talk about CA-125 testing on a grand scale and its lack of impact on overall survival, she said. But when there's an individual who has a history of ovarian cancer sitting in front of you, it's a completely different story. Now, I don't understand this at all. Doctors should feel an obligation to be honest and to either offer effective and safe alternatives to patients, or to just admit that in some situations, and it is the case with ovarian cancer, that medicine just doesn't have a good alternative at this time. I think doctors need some ethics training. And I think we have to be careful. I think I've had many people come in here and talk to me who've been told by doctors, you know, you have 3 months to live, you're going to die. I mean, I think we've got to be very careful that we don't frame things in negative points of view, but I also think that we have to be honest with people and you know, telling somebody to take this test knowing it's useless and that it can be harmful and that the treatment doesn't do any good, but we're going to just do this anyway is a terrible breach of the patient-doctor relationship. One last thing I'll add about this is a few weeks ago I filmed one of these video clips on another study that talked about the difference between what oncologists think treatment will deliver for patients and what the patients who are getting the treatment thinks is going to happen to them. And there's this huge disconnect. Patients thought they were getting treatment that was going to save their life, while doctors were pretty crystal clear in many situations that there was no way that these patients were even going to live till the end of the year. And so that represents a failure of doctors to communicate with the accuracy of the situation to the patient. And then they complain about, they have the nerve, Kelly Turner talked about this in her book Radical Remission, to complain about the fact that if you start talking to patients about changing their diet or alternative therapy, that you might give them false hope. I mean, what do you call this garbage, right? Well, that's all for today. As usual, please pass this on to anybody who you think would enjoy reading it, and I will be back to you next week with more news.